My background is in international development. I studied that at McGill University. I went on to do medical school at Dartmouth. I studied emergency medicine at Dartmouth as well. Graduated in 2016, moved to Peru full time. So for the last whatever number of years, I've been going up every month, do 10 shifts, come back. Just in the last 6 months, I've got little boys, 6 and 3. And so I've gone essentially like 50% time. So I go for about 2 weeks every time I go, but I go every other month now. That's the fast version of me. So I'm happy to discuss really anything that you would like to discuss, but I'm also happy to kind of facilitate some conversation. So if you have questions, please shoot. I think we're shooting for like an hour-ish. That's cool. What is this? Sort of ish, kind of? What would you consider it? You know, weight or your smoking status is going to have to do with health, or, you know, whether you have a family history of heart disease, things like that. But it turns out that, you know, like you said, what kind of house you live in, what kind of water you drink, what level of education you have, right? One easy and down and dirty way, right? If I have open heart surgery and a 10-year-old boy that lives in Pamplona Alta, which is where you guys have been, those kind of communities, has open heart surgery, who do you think would have a better outcome? Probably me, right? Even though I'm a 45-year-old male and this is a 10-year-old, and 10-year-old's pretty healthy, 10-year-old's going back to a situation where they may not have food. They may live with 15 other people in the house. They may not understand the significance of what does it mean if my son gets a fever? Whereas if I had open heart surgery and if I get a fever, I'd be pretty concerned and I'd figure those things out, right? I think you have seen in this week the reality of that in ways that you probably haven't seen as much at home. Yes. Is there a vaccine? Yes. So why is it killing so many women? Yeah, accessibility, how to deliver healthcare, because the problem is not that we need like a silver bullet and a medicine and a pill to solve a disease. It's actually about how you deliver that medicine, how you actually get the care to the person so that they can use it and benefit from it. We can solve all the diseases in the world, but if you don't actually deliver the cure to the people who need the cure, then you've done nothing. And I think so much of our education is focused on PhD this and research this and bench this and the new treatment for this, and oh God, if we just had a cure for HIV, that would solve the world. And yet women are still dying of cervical cancer, and we do have a cure. And so I think that's a question that we have to ask ourselves in this sort of educational process is, if there are cures for things, why are people still suffering from those things? And it's really that I think the only finger you can point at is us, right? Is the people who deliver the care. And like you said, like, is your understanding of a patient really trying to get to the root cause of the problem? Or are you just trying to get to the symptom management, here's a pill and you're out of my room, right? And how far are you willing to go to really understand that, right? And I think a few of you have sort of touched on it a couple of times, like, do you want to learn Spanish? Do you want to learn the culture? Do you want to really dig deep and start to really grapple with some of the delivery things, right? So you can imagine my ability to deliver care in Houston, right, is pretty decent, right? And I'm using Spanish multiple times every single shift, right? Served me very well doing this kind of work, right? I wouldn't have those skills if I wasn't involved in this work though, right? And so I think sometimes these kind of 7-day blips out and really digging deep can kind of be a mirror that we look at ourselves and really say, and you take a moment of reflection. Is my understanding of social determinants of health as good as I thought? Am I able to deliver care in the way that I thought? Maybe, you know, that 10-week medical Spanish class I took wasn't quite enough. And we start to kind of think about like how we need to kind of grow and provide better care, right? So I think the learning piece, unfortunately, is something that we underestimate and undervalue, and is really important. To think that in Netflix you're gonna feel the way you felt standing in Pamplona Alta and like using all of your senses and really having that impact you, right? And so my hope, right, I've been doing this a long time, 20 some years now, and I realized at some point that I was not gonna be the solution. I think we all kind of naively think I'm gonna be a doctor and I'm gonna do these things, right? And what I started to realize is like we, as a group of people that care about this, have to really up our game, right? And like how we're gonna deliver this care. We have to have moments like this that we can really talk about these kinds of things and really kind of reflect on these things so that when we go home, right, the goal is you've put on a new filter, right? There's new glasses on your face, you're seeing things in a slightly different way, and you're gonna take that home with you. Question of, I love this listening values, like this is exactly the things that I think we need to think about, is the reality is we do make those decisions. We do go and say, I want my grandma to get the $100,000 care, and And I have never yet been in the emergency room when a loved one comes in and is like, you can let her die. That, nope, Like, everybody's like, let's provide the best care we can, right? And so I think there's this, maybe not for you, maybe you are smarter than I was in my generation, but there is a trap in which we get stuck in this world of like best use of resources, sustainability talk, and we start looking at people of different places with different lenses than we look at our own grandmother. And all of a sudden, I think you're right. Like, who are we to judge? Like, that's grandma, right? And that is not to say that screw the kids with the malaria. That is not what I'm saying. But I think you're right to pause and think, really, and not to like totally drag this out, but to cut to the chase. The way that MedLife has built trust is what you guys are saying. Okay? So there are things that are sustainable and kind of good public health practices, helping improve access to water, cervical cancer stuff. But there's also just some stuff that are like heart-wrenching that I'm gonna put not in the sustainable bucket, but in the ethical bucket. And there may not be sustainable. Getting my grandma chemotherapy for $100,000 for metastatic cancer is not a healthcare sustainability project. But is it ethical? Yes, it is ethical. And so I think as people that are gonna kind of administer these resources and do the kind of work that we wanna do, you guys are hitting it right on the head, right? Is listening, is thinking about priorities, is not coming in and dictating terms, right? One of the things that I think about for MedLife is for many, many, many years, right? And I'm talking like 500 years, people with resources came to communities like this and said, we're gonna take from you, right? We're gonna take minerals, we're gonna take people, we're gonna take crops, we're gonna take all this stuff. If we were to come and just come in and say, hey, we're gonna take education, you know, maybe that's a more noble thing than taking the gold. But does that change the paradigm? Does that change how we're working, or are we just still coming in and taking, right? And the way you approach it is, I think you listen to people's concerns and you try and dedicate some resources to those concerns, even when it's not your highest priority. Back to this question of trust is how we've built trust, right? Is basically saying, from a physician perspective, a kid that gets diarrhea from water may very well be a viral thing, may even be bacterial, and they may never need antibiotics, right? But if I blow off that parent with the kid with the diarrhea and I'm like, what you really need to do is fix the water source, and that's what we're gonna do, and I'm gonna ignore your kid, you know how long they're gonna trust me? And so I think some of it is it's hard. When you get into med school, you start to figure this out. We're so driven on the root cause treatment, right? And the symptom, oh, it's a symptom, tough through it, right? But patients care about symptoms, right? And so if you ignore that, or communities, and you're just like, no, we're gonna do this, you lose trust like this, and it becomes an uphill battle.